A lot of times patients come into our office and all of their teeth are failing. And those patients have a number of options available. One of them, the most traditional, would be a denture. From a functional standpoint, they provide about the least functionality for that patient. The other downside of a denture is the bone underneath it tends to erode over time, so that if a patient's in a denture long term, they end up becoming less and less stable. The next step up for a patient would be to place 2 or 4 implants in order for that denture to snap in and out. This really helps with people who have a little bit less bone, and it helps to stabilize and retain the denture so it's more comfortable for the patient. There is still a little bit of wiggle, and so when it comes to things like chewing on harder foods or chewier foods, they're not nearly as successful as teeth, but they're a huge step up from dentures. One of the other options that a patient has is to place 4 to 6 implants and have teeth that attach directly to them. These are not teeth that snap in and out. The patient doesn't remove them. They stay in 24 hours a day, 7 days a week. These teeth do give the patient a lot more functionality, a lot more ability to chew. They can look very aesthetic, but that is one of the options that I think a lot of patients are gravitating towards today. When a patient elects to go with teeth that do attach or screw onto a number of implants, they have options as to what those teeth are made of. The traditional denture is made of plastic teeth, and it looks pretty good, but it obviously will never look quite as good as a porcelain or a zirconia will. If we do have enough implants to support it, patients can also get a much more natural looking zirconia or porcelain tooth replacement. Those tend to last a little bit longer, they look a little bit more aesthetic, they look a little bit more natural. Often, if everything's planned and executed correctly, the teeth are removed in the same day. We're able to place implants and we're able to attach teeth. And so they're walking in with natural teeth and they're walking out with teeth that are fixed in place, and they're in place for the entire healing period. And so there's no sort of awkward or ugly duckling stage to treatment.